Good afternoon, everyone. I'm Johanu Botha, Operations Planning and Logistics Lead of the Vaccine Implementation Task Force. We have reached another important milestone in immunizing Manitobans. We have reached more than 40% of adults immunized and more than 500,000 doses administered. We will completely exhaust the vaccine supply we have on hand right now within a week and a half. As more vaccine arrives in our province, that means our operations are also accelerating in response. This week, we gave nearly 60,000 doses in super sites, pop-up clinics, and through our focused immunization teams. And next week, we expect to give nearly 83,000 doses through those same channels. The Lila super site in Winnipeg is opening this Friday, with Steinbach and Dauphin slated for the 10th and the 18th, respectively. Today, we're also announcing that the next super site for Interlake Eastern Regional Health Authority will be in Gimli at the Gimli Recreation Center and is expected to open later this month as well. We have been expanding our eligibility regularly so that more people are eligible to be immunized as soon as possible, given the supply that we have on hand. We aim to have all Manitobans 12 years and older eligible for first dose appointments by May 21st. But the most common question we hear when people come for their first dose is, when will I get my second dose? We're aiming to have the first group of people call or book online starting May 22nd to make appointments for their second doses. The second doses will begin going into arms no later than mid-June. If we have contact information for people, and we have for many of you, we will be reaching out to you directly by text or email or phone to let you know when you can book your second dose. And of course, we'll make larger announcements as well for when you are eligible for your second dose. I do want to emphasize that right now we are still focused on first dose appointments, getting through that phase, and only first dose appointments should be made at this time. Vaccine supply is ramping up, and we are ready to deliver what we receive to Manitobans in the days and weeks ahead. With that, I will turn it to Dr. Reimer.
Thank you. Good afternoon. I'm Dr. Jos Reimer, Medical Lead for the Vaccine Implementation Task Force. With vaccine supplies expanding, as Johanu has mentioned, I am pleased to announce that eligibility continues to expand for the vaccine. Yesterday, we announced our final 3 community-based expansions, which include River East South, St. Vital North, and Seven Oaks East in Winnipeg. This means that people who live or who work in specific jobs in these communities who are 18 years or older are eligible to be immunized now. Hier, nous avons annoncé l'ouverture de la vaccination pour les résidents et les travailleurs de 3 dernières collectivités, à savoir River East Sud, Saint Vital Nord et Seven Oaks Est à Winnipeg. Cela signifie que les personnes de 18 ans et plus qui résident ou qui occupent un emploi désigné dans ce secteur peuvent maintenant être vaccinées. In total, there are 14 community areas in Winnipeg, Prairie Mountain Health, and Interlake Eastern where eligibility has been expanded to those adults. In addition, all adults who live or work in the Northern Regional Health Authority continue to be eligible. If you're not sure if you fit within these communities, an interactive and searchable map is available at manitoba.ca/vaccine. And you can also help spread the word in your community so that other people know that they are eligible to book a vaccine appointment. We have created downloadable posters with maps for each community, and these are available at protectmb.ca under Ways to Help. These community-based eligibility approaches are important to address systemic barriers. It provides added protection when entire households can be immunized at the same time. Earlier this week, I was also honored to join my colleague, Dr. Marcia Anderson, to announce that eligibility has been expanded to include all Indigenous people in Manitoba who are age 18 and older, which includes First Nation, Métis, and Inuit people. And so today, we take the next step in making the vaccine available to more Manitobans. Today, eligibility is expanded to include all Manitobans aged 45 and up. Il est maintenant temps de passer à la prochaine étape qui nous permettra de rendre le vaccin accessible à un plus grand nombre de nos concitoyens. Je vous annonce donc qu'à compter d'aujourd'hui, la vaccination est ouverte à toutes les Manitobaines et à tous les Manitobains qui sont âgés de 85 ans et plus. 45 ans et plus. This is one of the largest age-based expansions we have announced so far, which reflects more vaccine now being available to us. We will now be regularly updating age-based eligibility based on vaccine supply and available appointments. Our plan is for all adults in Manitoba, as well as youth in Manitoba, to be eligible to book an appointment by May 21st. Many of you probably heard that as of this morning, Health Canada authorized using the Pfizer vaccine for children starting at age 12. Our team is reviewing that information. We want our clinical team to come up with recommendations very shortly so that we can share with all of Manitobans exactly how we plan to do the rollout for those Manitobans. So we don't have the exact details to share today, but we do intend to include eligibility for younger Manitobans along with adults as we move forward. As Johanu mentioned, we are also developing our plans for dose 2. We need to ensure that those who are at most risk related to their health conditions can book their second dose first. So our clinical team and our medical advisory committee have reviewed health conditions where we have concerns that individuals may not get a sufficient immune response after one dose, and we'll be making those individuals eligible for their second dose first. So some examples of these health conditions include people who have received an organ transplant, or those people with cancer who are actively receiving chemotherapy treatment. So our final list is just getting fine-tuned and reviewed by some of the clinicians who were not able to participate in the meetings, and we should in the coming days be able to share the full list with Manitobans. After we have opened up eligibility to those people where the first dose may not provide enough protection, we will then expand eligibility based on when you had your first dose. So this is an exciting and important step. We want to provide the greatest possible protection against COVID-19, including the variants that are circulating in our province. We have seen that younger people are being infected and having more serious outcomes than what we saw in the first two waves. So if it's not your turn yet, I want you to know that it will be soon. This week has added a bit of uncertainty and maybe more questions for people who are unsure about what vaccine they should get. You may want to know whether you should wait to be eligible for an mRNA vaccine like Pfizer or Moderna, or if you should get AstraZeneca if you're eligible for that one first. Our clinical team continues to believe and continues to recommend that Manitobans should get whatever vaccine is first available to them. We have reviewed NACI's recommendations, we have reviewed the local epidemiology, and we created our eligibility based on a knowledge that those individuals greatly benefit from that vaccine. So for those people who are eligible for AstraZeneca, choosing to delay vaccine in order to receive mRNA could mean that you end up being infected and end up in the hospital. So we want people who are eligible to know that we have carefully reviewed the data that we have and made sure that we are only recommending it to those people that are at high risk of ending up in the hospital. And so we want you to be protected as soon as possible and not wait those additional weeks where you could be exposed to COVID. We are in a race against the virus. We're in a race against the variants, and we are seeing the devastating effects that it has on people, on our healthcare system, and on our healthcare providers. But before we turn it over to questions, I do want to highlight something that is worth celebrating. We talk a lot about the communities where we want to improve vaccine uptake and how we can work with our partners and local leaders to answer questions, address concerns, and support people who might be facing barriers to being immunized. But I also want to talk about the communities where immunization uptake has so far been really good. I'd like to give a shout out to the people and the teams who are doing this work and helping to protect their communities from COVID. All of the following communities have immunization rates for first doses of over 60%, which is wonderful to see. So this includes Island Lake, Norway House and Norway House Cree Nation, Cross Lake and Pimichikamak, Bayline, Churchill, and Gimli. We still have a lot of work ahead of us to protect as many people in Manitoba as possible, but we need to celebrate these successes. And so I want to say a big thank you to the teams as well as to the people who live in those communities for protecting your communities against COVID. And I can now turn it over to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CTV Winnipeg, Michelle.
Hello. About the age-based approach, going back to it, some communities that come to mind who've been asking for prioritization, immunocompromised people under 30, teachers as well. Are you looking at any other prioritization based on immunocompromised status or job?
So, we included teachers in our community-based approach because the government wanted to ensure that we provided protection to those settings where we had the most concern about possible transmission in the community. We also are including those people whose immunocompromising condition makes us concerned about how well dose 1 might work. We're putting them front of the line for dose 2. So those are the things that we're focusing on right now, but we're excited that all Manitobans in a very short amount of time will be eligible to book their first dose. And so since our timelines are so short and the supply is coming in so quickly, we want to make sure that we get everybody eligible as quickly as we possibly can.
Thank you. And with this Health Canada approval for 12 to 15-year-olds, is this going to kind of just roll right into the age-based rollout, like kind of after we get done with 18 and 17 and 16, you just keep going down younger? And what about youth that are 17 and 16 that work essential jobs? Would they kind of be able to get a vaccine a little bit sooner?
Yeah, so we don't have the final details yet on exactly how we're going to do the rollout for youth. We had previously been expecting this announcement more likely to be in June, so it was a bit of a surprise for us today. That said, we have done a lot of work and conversations on both the clinical and the operations side to prepare for this because having seen the data, we knew that there was a very strong chance that this approval would be coming. Certainly we are waiting for NACI to give us some guidance, but unless there's some surprise that comes from NACI, we expect that we'll be able to continue with youth much like we have done other age categories. But we are also open to adjusting should NACI come with some recommendations that are not consistent with that approach.
From City News, Alex.
Good afternoon. Thank you for the time here. Once again, vaccine eligibility is going down every Monday, Wednesday, and Friday, as you guys mentioned. Is there a certain number that it drops each time, or is that all based on vaccine availability?
I could take that one. So the reason we didn't lock into a specific age amount by which we will drop every Monday, Wednesday, Friday is we want to give ourselves some flexibility to have a longer or a broader drop if there are appointments available. So when we go from 50 to 45 as we went today, we're monitoring closely to see that this new cohort, these thousands of Manitobans that are now eligible, are booking at a good rate. If and this is not what we want very high uptake, but if they're not booking at quite as a high rate as we'd like, then the next cohort that we reduce it by might be a bit bigger. So we want to be able to monitor this. We know that we're going to get to 12 plus, unless there's a surprise from NACI, as Dr. Reimer said. We'll be able to get to 12 plus eligibility by May 21st either way. All roads lead to May 21st for all Manitobans being able to book an appointment. But we want some flexibility to turn the system hotter and open up a bigger cohort so we can fill up those appointments faster. So that's why we're not locking into a certain age range. Although if we look at between now and May 21st, it's probably fair that we'll be around the 5-year approximate drop Monday, Wednesday, Friday, but giving us some room to move.
Sounds good. And to kind of follow up on that, with the J&J vaccine, when it does become available in Canada, could the age eligibility drop further at a faster rate? Like, could the date of May 21st go up, or will it relatively stay the same?
So in terms of that overall timeline, I'd say that it probably won't make a massive difference. I'll let Dr. Reimer speak on the eligibility component for that particular vaccine type.
Yeah, so the age eligibility for AstraZeneca and Johnson & Johnson is a clinical rationale, not a supply rationale. So as I mentioned earlier, we did analysis of our local data and the NACI recommendations to develop the guidelines or the eligibility that we have to ensure that those people who are eligible will clearly benefit from the vaccine, and where if they chose to wait, they would be at higher risk because of that choice than if we were to offer them the vaccine. Now, as far as how Johnson & Johnson might impact our eligibility overall, we're only expecting to receive not even 11,000 doses. So compared to the volume that we get from Pfizer and Moderna, that 11,000 will have a small, if any, impact on our ability to reach that date.
From CHVN, Taylor.
Hi, good afternoon. If Manitoba does approve for those 12 to 17 for the vaccine, what percentage of that population are you hoping for to get that vaccine?
I mean, we're always hoping to have as many Manitobans as possible immunized. We've used the 70% as an estimate for our goal for herd immunity. But we would be, overjoyed to get more than that. We'd like to get, 80, 90+% of Manitobans of all eligible ages immunized, because the more of us who receive the vaccine, the less chance there is that the virus can move in our communities. So our goals remain the same regardless of what age category we're talking about. And really, we're going to work hard to get the vaccine into as many possible arms as we can.
Thanks. And if someone is under 18, will they need parental guardian permission to get the vaccine?
So we have processes that have been set up with our school-based, our usual annual programs that we can follow in this circumstance. We also, within the healthcare system, have long-established consent processes for mature minors as well. So in the school-based systems, we do send consents home to have parents sign them. But we also recognize that there are times where someone who's under 18 may choose to seek medical services without parental consent. And so it is the job of the healthcare provider to ensure that they do have the capacity to make that informed decision if their parent isn't available to provide that consent along with them. So we will follow our existing processes for parental consent that we do for all other parts of our healthcare system.
From the Winnipeg Free Press, Danielle.
Hi there. When it comes to the Johnson & Johnson vaccine, and based on what we've seen in the slower uptake of AstraZeneca, do you think that you'll have to use the J&J shot for home visits, for example, or for immunization teams?
So we've, as I mentioned, opened up eligibility to those groups where the data tells us that there's a very clear benefit for them to receive the vaccine, and that choosing to wait does put them at higher risk of being exposed to the virus, of higher risk of ending up in the hospital than the risk associated with the vaccines. So we will continue to encourage all Manitobans to get whatever vaccine is available to them, and make AstraZeneca or Johnson & Johnson available as one of those options for people through their physicians, through pharmacists, as we move forward.
Okay, thanks. And now that we're talking about second doses, is the province still pursuing a secure immunization card? And when might Manitobans have access to that?
So in terms of secure immunization card, that's a good question for government on what that might look like. I know that we want to be ready to have a certificate for Manitoba should it be needed in other jurisdictions. But right now, the task force is focused on just getting doses in arms as quickly as possible. Of course, Manitobans in Manitoba who's received the dose can get their record online to see which dose they received and when they received it and what kind, which will be important information when they start booking for their second dose.
From Global News, Joe.
Hi there. So I know you mentioned that you're still working on some details for the roll-up for kids, but any idea if kids will be getting vaccinated at super sites or something like pop-up sites at schools being considered at this time? Anything like that?
So I can field this one first, and maybe pivot to you, Dr. Reimer. So we've built our system and our various tools in the toolkit to accommodate this youth group, 12 to 17. We knew from the medical team that this was likely. So on the planning and the operations side, we're by no means surprised by the announcement. That's why as just a cohort of under around 100,000 or so, we can fit them into our eligibility process leading all the way to May 21st. And we know that we can move the majority of them through one of our existing channels. We've built the system to be ready for this. Now, our focus is doses in arms quickly, and the vast majority of youth can certainly go through a super site. In terms of being accompanied by a guardian or a parent, it's not dissimilar from when our more vulnerable Manitobans or elderly Manitobans had accompaniment as well. It's built into the process of these sites, similar to our pop-ups. It's youth friendly. But we know that this won't work for everyone between the ages of 12 and 17. It's just like those faster channels hasn't worked for everyone in the other cohorts either. So we will look to our focused immunization teams or a bit more tailored approach where it is needed and in contexts where it is needed. But our goal at the moment, as Dr. Reimer said, is this is a race. And it's a race against the variants, and it's a race against the virus. So velocity and speed and getting doses in arms safely is the current priority. And we know that our super sites and then secondarily our pop-ups are by far the best way to do that.
Thank you. And I guess on the early June target date to have I guess 70% of the population, at least with the first dose. But I guess that means what the province is capable of. But as we get into the younger age groups, are you confident that 70% of Manitobans will be signed up by then, based on what you're seeing now?
So there's two questions there. There's the supply coming in, which is largely driving our timelines for when first doses will be in all arms for Manitobans who would like it. And then there's the capacity piece, and we're able to meet whatever supply comes our way. And then there's the discussion around uptake or hesitancy. So I will go to Dr. Reimer for that one. But what I can say is, in terms of the supply coming in, Those amounts, those estimates from the federal government, or projections rather, hasn't changed. What's changed with this new cohort of 12 to 17 is that more Manitobans can now get the shot, which is great news. So whereas supply previously put us between June 4th and June 8th to have eligible Manitobans actually have the dose in an arm, assuming a 70% uptake rate. That's just extended by about a week, probably a bit less, because there's only 100,000 individuals within this 12 to 17 group. But it will extend the timeline a bit because there's more people to immunize, and the supply will only stretch so far. So now we're looking at the timeline of June 11th to June 15th to have all 12 plus eligible Manitobans vaccinated. But in terms of the rate at which they might sign up and uptake, I'll pivot to you, Dr. Reimer, on that piece.
Yeah, so far we've seen great uptake overall. When we look at the cohorts that have been eligible the longest, we see over 80% have signed up for a vaccine. So I would say that right now we're very encouraged by what we're seeing overall in Manitoba, and have no reason to believe that we'll see anything different as we go younger. But our message remains the same, that we want as many Manitobans as possible to get the vaccine as quickly as possible. And so we look forward to seeing those numbers start to rise in our younger cohorts as well.
From the Brandon Sun, Kim.
Good afternoon. My question is, there seems to be a lot of people believing that Manitoba is seeing a significant portion of COVID hospitalizations of people who were vaccinated. Can you clarify that, and is there any data available?
So I don't have any data in front of me right now about the rates of hospitalization amongst those who have or have not received a dose of the vaccine. What we have seen is a very clear decrease in the number of infections, outbreaks, and severe outcomes in places where we've had a lot of coverage of the vaccine. So our personal care homes have had their cases drastically reduced and outbreaks drastically reduced because they received the vaccine. Likewise, in the Northern Regional Health Authority, we're starting to see numbers come down despite the fact that they're going up in other parts of the province, which we believe is largely due to better coverage overall of vaccine in the north. And fewer people are being hospitalized, fewer people are having to be flown to Winnipeg, for example. So, we'd have to take that question to Dr. Roussin and the rest of the public health team to get more of an analysis of those in hospital. But we are encouraged at what we're seeing at the community level about the impact of vaccines so far in Manitoba.
Thank you. I have no further questions.
From CJOB, Skylar.
Thank you for your time. Once again, you two. Dr. Reimer, you've given a couple of great explanations on herd immunity in the past. Can you tell us what another 100,000 Manitobans being made able to get a shot can do to that number? How much more quickly we might be able to achieve it, or how much more effective that first round of doses could be?
Yeah, and we were, surprised a bit by timing, but certainly not by the fact that this age group was included. And it's great news for Manitobans that we have more eligibility now in order to help us achieve herd immunity. The number that we quote often is 70%. So what we believe, based on the transmission data we've seen for this virus throughout the world, is that once about 70% of your population is immune, there's just not enough people who can get the virus in the community that the virus can survive and go person to person anymore, because there's just not enough people who are able to be infected and transmit it. And so we certainly are aiming for 70% of the population overall to get that hard stop definition of herd immunity, where really the virus can't circulate much, if at all. Now, the more Manitobans we have eligible, the faster we can get to 70% of us being immunized. If only 50% of us are eligible, even if all of us got the vaccine, we can't possibly have 70% of all of Manitoba immunized. So we are excited that we have more opportunity to protect individuals by receiving the vaccine, but also protect each other by having fewer people who can spread the virus in our province. And we're hopeful that the ongoing trials that Moderna is doing, as well as Pfizer's younger trials, will in the future be expanding eligibility for those vaccines even further, so that we have more options for the 12 plus, as well as in the future hopefully are able to also offer the vaccine to kids who are under 12 as well.
Thank you for that. And I guess either or both of you could answer this one. I'm just wondering how you guys feel today. It's been hard to see a finish line, or I guess a halfway point if we're talking about first doses, throughout this process. But today was kind of that day. Is this a significant day for you guys? And I'm just wondering how you feel moving forward now that Manitobans have that information.
I mean, I think we both feel very excited to be telling Manitoba when they can expect their first dose. That's been our goal for quite a while, so it's a pretty big relief. I've certainly joked with Johanu that I'm hoping to take a vacation at some point after we get all of these first doses in. So we'll see if that actually happens. But this is what we've been working for. So we are excited to see at least the first leg of this race coming to a close in so close in the future. But maybe I'll let Johanu speak about his own feelings right now.
Well, I'll just say there's no way Dr. Reimer's getting a vacation without me getting a vacation. So if she's out, then I'm out too. But there's nothing much further to add. Just that we're very excited. And the task force as a whole is very excited as well. There's been many hours put in by everyone, and not just within the task force, but with the regional health authority partners and municipal partners and Manitobans mainly. So it's a line in the sand that we're excited, very excited to see.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Dr. Reimer, can you confirm the plan to announce that teachers will be eligible for vaccinations as of tomorrow?
So I have not been informed of any final plan around announcements for tomorrow. The plan that we've already announced is that teachers who work in the priority communities, as well as any other staff in the K-12 schools, are already eligible to book for a vaccine. And so I'll leave any future announcements to those announcements.
All right, thank you for that. It looks like I'm hearing that Pfizer is changing its shelf life for its doses to 31 days. In terms, I believe that's post-thawing of those doses. Will that affect the rollout for children vaccines? Like, will they be able to maybe then go and get them at doctors or pharmacies?
You go ahead.
Okay, thanks. I'll do the first bit of the answer at least. So it is good news around Pfizer whenever the transportation requirements are easier. So it's good news. I would say from the operational side that even if Pfizer does become easier to move around and to store and to thaw, it is still much faster to push them through super sites. So operationally, when we look at all these vaccines becoming easier to move around, we're sort of targeting and looking at second or third dose to do that kind of very high tailored, more small pipe approach, because right now the race is still on. We need to pick the biggest pipe to get Manitobans vaccinated. That said, this does allow opportunities, and certainly there's a clinical aspect on how to administer them. So maybe I'll go to Dr. Reimer on that.
Yeah, so Pfizer has continued to do stability studies to better understand the extent at which we can push storage and transportation and maintain a safe and effective vaccine. So, they moved to allow us to temporarily store it in a regular freezer as opposed to the -80 conditions. And they're now looking at being able to expand the length of time that it can be in the fridge after it's thawed, from 6 days up to potentially 30 days, more like Moderna. And so any time that we get better stability data, that does give us that flexibility to be able to use it more similarly to how we use Moderna. And while we still want to focus, as Johanu just said, on getting vaccines into Manitobans as quickly as possible to address this third wave as quickly as we can, it does also give us some flexibility for what products we can use when we are trying to tailor some of our responses to people who are not well served by our super sites.
From CBC Manitoba, Bart.
Hi there. I just want to make sure you've been very careful in your statements about the vaccinations for teens aged 12 to 17 here. So you're talking about how you're going to do it, but is there anything with your clinical guidance or otherwise that would prevent people aged 12 to 17 from getting vaccinated later this spring?
I would say, our plan right now would be to continue with our age-based approach until we reach age 12. But we're putting a lot of caveats on that because we haven't seen anything from NACI, and we do try to follow NACI wherever it makes sense for Manitoba to do that. This announcement from Health Canada came a lot earlier than we were expecting, which overall is great news for Manitobans. But it just hasn't, since it came out this morning, it just hasn't given us the time to meet as a clinical team to finalize our recommendations. Having reviewed the data myself, and I know our clinical team has reviewed the Pfizer data, I would be surprised if we were not able to offer Pfizer to youth in the very near future. But the best I can say is that our plan right now would be to use the age-based approach until we reach age 12. But I want to make sure Manitobans are aware that that is not set in stone.
All right, thank you for that clarification. Forgive me, I lost my train of thought for a moment. Thanks, it happens. The plan for the second doses. Earlier this morning, Mr. Botha talked about the third doses or the booster shots. Would that potentially happen concurrently? For example, if we see a lot more genetic drift with some of the variants, and we see that we are seeing a lot more people who have been vaccinated getting cases, mild or otherwise, is there a plan for concurrent second doses and booster shots, or would boosters only follow those second doses?
I think that depends on the length of time that it takes to get the dose 2 round done. While we're announcing when we'll have enough doses available, we know that there will be some Manitobans who, despite being eligible, have not yet gotten their first dose, or who may not sign up immediately to get their second dose. So we recognize that in our rollout, we'll be having to give dose 1 and dose 2 for some groups concurrently. So there'll certainly be some folks who book an appointment in July for their first dose. And we welcome them to book if they haven't already booked at that point. Dose 3 is a bit further in the future. We don't know yet what the plan is for it. We do know that some of the manufacturers are adjusting the vaccine to be able to better respond to some of the variants. So it's possible that we may have sort of a version 2 of some of these vaccines that we could use for a third dose in the future. But so far, we just don't have enough data from the manufacturers to let us know exactly what our dose 3 plan is going to be.
Thanks for that.
From the Canadian Press, Steve.
Oh, hi, Dr. Reimer. I'm just going to try to get a clarification on the clarification you gave Bart just now. Do I understand correctly that Manitoba is going to administer Pfizer to the 12 to 17 group, and that the decision that is to be made is where in the priority list the 12 to 17s may get their shot?
So that is the plan right now, but I am trying to be cautious about my statements because we haven't seen anything from NACI. So it's certainly possible that they could surprise us with some analysis where we would need to take a step back and reconsider. That's not my expectation. We've looked at the data and we think that it's very supportive of including down to age 12 for eligibility. But I'm just trying to be cautious without that NACI statement so that Manitobans know that we haven't set our final plan into stone, and we do want to make sure that we take NACI's recommendations into the planning as soon as we have those available.
Thank you. And in terms of the priority list, if it goes strictly by age, we'll get down to that teenage group very close to the end of the school year. And you had mentioned that the government wanted teachers in hot zones to be included among the priority workforce groups. Is there any chance that teenagers, the 12 to 17 group, will be bumped up in terms of age group, given that they're still in school, and by the time they would get there under normal circumstances, just going strictly by age, the school year would be almost over?
So at this point, we're really talking about a matter of a few weeks before all Manitobans are eligible to book an appointment. And so there's actually very little we can do to bump anybody up in eligibility because of how quickly we're going to reach all Manitobans. So as I said, our plan today, having just heard from Health Canada this morning, would be to proceed with our age-based approach. But we are absolutely going to be taking this new information to our clinical teams to review and come up with a final plan in the very near future.
Thanks, everyone. This concludes our media briefing.